Coming up on this episode of the Paw Report, my friend Charlie and I are going to talk to Dr. Marci Kirk from Albin Animal Hospital all about how to assess your pet's wellness at home and some tips to keep them healthy at home. And we can also talk about finding out when you should be calling your veterinarian. Stay tuned, you'll want to see this next on the Paw Report. Production for the Paw Report is made possible by
Inyart Tire and Auto Center in Charleston and Mattoon. Inyart offers complete auto repair. Inyart Tire and Auto Center cares about our community and thanks you for being a responsible pet owner. More information at inyart.com.
Hello and welcome to this episode of the Paw Report. I am Kate Pleasant, your host, and I'm here with Dr. Marci Kirk from Albin Animal Hospitals and Charlie. He's a Golden Retriever Labrador mix, is that right?
Golden Retriever Poodle.
Mix. Yeah. And look how cute he is. And he's being very good.
Yeah,
so
this is surprising.
That's a Golden Doodle for those that are maybe more familiar with that term, right? He's a Golden Doodle. And how old is Charlie?
He'll be 3 in July.
He'll be 3. Okay,
yeah.
So he's still a puppy.
Yeah, very much so.
And today we're talking about how to assess your pets at home, maybe time to see when they're sick or when they might need to see a veterinarian or what they might need. So we're just talking about general kind of health assessment at home, right?
Yeah, and some things that might be able to look at home that might be able to help your vet a little bit more to direct, some diagnoses since they can't talk to us.
Right, some signs that we may need to pay attention to.
The more information we have, the better, we can try to pinpoint, what's going on. So, and kind of what, you might see your vet do or what they're looking for on a physical exam and things like that. So I thought that would be helpful to some people. You don't know if you need to call the emergency or not. So
right, because that can be difficult. You're at home and something that you might think is a really big deal might not actually be a big deal. So this might be helpful for determining that.
Yeah, a really good example of something like that is, you see Charlie, he's panting. He's just happy, he's excited. That's a normal breathing pattern. But we get a lot of calls, especially this time of year and in the spring, about dogs that are choking or they're coughing and they can't breathe.
Okay.
And it's probably more likely to be like a reverse sneezing episode. And I'm not very good at making the sound.
I was going to say, are you going to do that?
But Charlie has done it. He's woken me up at 3 o'clock in the morning before. And, it's really scary if you don't know what's going on. So if you kind of know what's normal for your dog, they're not going to care. No vet's going to care if you call, and they can at least tell you if it's something that's important or not. So if you can kind of be attuned to what's normal for your dog, that's going to help a doctor, kind of make more decisions for them as well.
Okay, and so where do we start with that at home? What are some good guidelines or rules for assessing your pet's health at home?
Sure. Well, when they're laying down, I think it's really important to notice how they're breathing. If you start that now, you're going to notice if they have a problem later. So, he's just breathing normally. He's not really having his abdomen have to push. It's all in his chest, which is totally normal. Panting is normal for dogs. That's how they move air when they're excited. It's how they sweat. It's all of those things kind of coming together. It's whenever you really see them kind of sucking in the air and pushing it out, that can be an issue. So that's one of the first things you want to look at, if they've had an accident or something, to really assess their breathing, because let's say a dog, got bumped by a car. It can take 24 to 48 hours for that bruising on their lungs to show up. So even if you've taken them to the vet, they may have you monitoring at home to see how they're breathing. So you kind of need to know what normal is in your dog. Some dogs just pant normally, and just that's how they are until they're sleeping.
But you wouldn't know that unless you had that baseline.
Right. So it's really important if you can kind of, hone in on that it will help you make some decisions down the line as well.
Okay, so breathing is one thing to look at. Should we be looking at body structure?
Yeah, so I think, he's very relaxed and everything, but if you can kind of assess, and every breed is different, so it's going to matter with your breed, but when he stands up, you'll notice, he's got a nice little waist, nice little tuck in his abdomen, so he's a really good weight. And so that's an important thing to know too, because that's going to rule in or out some things. If your dog suddenly put on a bunch of weight, that might maybe lead us down to one diagnosis, or if it's lost a lot of weight, like, hey, I used to be able to run my hands down my dog's back and I didn't feel any of its ribs, and now I can see them. So, kind of knowing what is normal for your dog. Now, when he gets really fluffy, I have to really kind of work to feel those ribs through his fluff, but not through a layer of fat.
Right.
Yeah. So, but there are some dogs very muscular. You kind of need to take that into consideration as well. So
it would depend on breed, but again, if you start with that baseline, when you get a dog, you'll notice over time, if that would change.
Right. You'll kind of know what's normal for your dog, because and there are some diseases that can cause like their muscle tone to go down, or and assessing their itchiness is another good thing to know,
Right.
because he's just an itchy guy,
Right.
and so that's
I have
normal
itchy
for
guys.
him, and but if your dog never itches, it may be something that you might want to take a look at, allergies or fleas or something, which is another thing your vet might look at.
Right. And you mentioned weight loss. That's kind of a popular one. We've talked about that on whole shows here. But what people don't think about a lot of times, it seems like, is that a little bit of weight loss can be a lot, depending on how quickly it happens.
Right. And so let's say you have an overweight pet. Your vet's told you need to go in, you need to lose weight, or your pet does. Hopefully they're not telling you.
I was going to say, hopefully your vet's not telling you need to lose weight.
But they go in, they tell you, okay, we need to work on weight loss. Let's make this our goal. Well, you want it to be on your terms, not because something's going wrong. Things like diabetes or, other conditions, kidney disease, cancer, they can cause weight loss to happen very rapidly, and maybe you don't know that that's happening. So you kind of need to know, if you're working on a diet, that's great, but we want it to happen on our own terms, not because something else is going on. So I think, knowing what is normal for your dog and what your vet wants you to do is very important.
What are some other physical abnormalities that we might notice, if we were physically feeling the dog or cat?
Tumors.
Okay.
Yeah, tumors are a big thing. If you want to run your hand down your dog regularly, especially these fluffy guys, because they can hide those really easily.
Sure.
And something else that you may notice your vet's going to look at, they're going to feel those lymph nodes. So they're going to feel the lymph nodes kind of like your doctor does, up underneath your chin and in your shoulder area and on the back. So if you notice something comes up in that area, you definitely want to take it to your vet. It could be something serious, or it could just be an infection like us.
Sure.
But you're going to notice things on the external if you just run your hand up and down your dog every once in a while. And just because there's a mass or a wart or something doesn't mean it's serious, but you want to know that it's there, and you want to know if there's any changes to it.
That was what I was going to say, kind of if you have the baseline, then you can note changes after that. So if it's getting bigger, smaller, changing in color, appearance, those kinds of things.
Something that I would definitely recommend, if you've got a fluffy dog, if you notice a mass and you can't get into your vet right away, shave it. Because there are many times where you'll forget where it's at, or it may get smaller. There are a couple of tumors that'll get smaller and then bigger and then smaller. Just mark it so you know where it's at and you can find it easily, because we try to run our hands down everything, but it can get lost in the fluff, or
that's a
you've
good
got an
point.
overweight dog or cat.
Sure.
If you just trim the hair, even just mark it somehow, put a little nail polish on it or something, we'll at least know where to look.
Right, because that is true. I've done that before too. We've felt like little knots on our dogs, and we've gone back to find them. They're fluffy, like Charlie, and you can't find them again, or you can't explain where they were. I think it was over here, but maybe it wasn't.
Well, and it's very confusing sometimes. They're like, okay, it's on the left. Well, then you get confused if you're looking at them, if it's on the left or if
Talked about that before. Which is the left, which is the right.
Yeah, I mean, it's still their left. So it's just, if you can mark it somehow, especially if you have to leave them with the doctor or something, that's very helpful. And then, we can take measurements as well to kind of help you, because if you check a mass every day, you're going to drive yourself crazy.
Right.
You're going to think it's getting bigger, and it may not be. So just to be familiar with what's normal for your pet is just so important to helping us kind of guide treatment.
Sure. And does this go the same for cats? I mean, should you be feeling the same way?
Especially cats, because cats, I think animals in general are really good at hiding things until it's, maybe too late.
That's
or
their
until
instinct,
it's,
right.
Right. Cats are worse. They're going to really hide it until they're sick. So when a cat comes into you sick, you know that it's really sick.
Because it's had it a while.
So yeah, especially cats, if they'll let you pet them and feel everything, that's great. And the weight for kitties is really important too.
So what about, we've talked about, physical body structure. We've talked a little bit about other things to look for. What about legs and feet? Are there certain things we should be noticing about legs and feet?
Yeah, so I think if you get a puppy or any dog, it's really important to start running your hands down their legs, get them used to having their paws messed with. That's going to make your life so much easier in the future, because those nail trims, you don't want them scared of that. So get them used to it, get them used to that.
Charlie clearly is annoyed.
He's very used to being palpated and pushed on. But get him used to that, because one of the first things we're going to look at if your dog comes in limping is check those nails.
Right.
Especially in the weather where, we're having ice right now, they can get those toenails caught and they can rip, and that's very painful.
Sure.
So, you know, that's going to be one of the first things you can assess at home, that maybe it's just a torn toenail and you can fix that. So you may
How
not
do you
even
fix
need
a torn toenail, by
well,
the way?
it depends on the dog. Sometimes it just has to kind of come off, which you may be able to do at home, or you may need the assistance of a doctor. But, you know, knowing if that's the case, that might help you from having to get x-rays or anything like that in the future to try to find it. So, yeah, and that will, like I said, make your life much easier if you just get them used to all that being messed with.
Right. What about pads? Are there certain things to look for about pads?
Yeah, and you gotta think, they're always on their feet. There's no way for them to avoid it. So their pads are very important to them. So if you do get an injury on your pad, it's going to be a long time healing. So I think in this weather, especially putting a little Vaseline on them, kind of coats them if you've got a cut or something.
That goes the same for summer as well. I mean, because
on
it's
the hot
right?
asphalt. Yeah, exactly. So checking those is really good too, because a slice in the pad, he had one when he was boarding. He just got, one of the girls was walking him and he just got cut, and it healed, but it took a little bit of time. I mean, it just
well, just like people, you know, hand and foot wounds heal a lot
it's so dry
slower.
and yep, you're using them all the time. So those are good things. And again, if they're used to those being messed with, it makes life so much easier, because you can trim those nails and it's not a stressful thing for them. And that's the same with the ears, you know, playing with their ears. And if you're used to it, then you're going to notice if they have like an infection or something before, and you can help give the vet.
Especially on those floppy-haired ear dogs, just keeping them clean. I hear a lot of times from groomers and things too. If you can keep them clean and keep the hair, you know, manageable in there, you can keep from getting infections and things like that.
Yep.
So
that's exactly right. Yeah.
And how do you treat, you know, we were talking about the feet and the pads. How do you treat a slice or a cut, or in a dog that wants to stand up all the time?
Sure, it's depends on the dog and the cut really. One of the girls that we work with, her dog got a pretty bad one, and he had to go in a boot for a little bit, like a little padded, because it just wouldn't heal, because it was just constantly. She's a very active dog. She was running a lot, so she was just re-aggravating it. Occasionally they need sutures, so you know you have to keep those clean and dry, which is difficult when it's raining or snowing or anything like that. So it just kind of depends on the situation, but a lot of times I use a lot of like Vaseline and gels and things just to keep it moist and not moist to wet, but moist so it'll heal.
Right, because it's got to have something in there to kind of dissolve up and heal it in. So what about, you know, tails? Cats have tails, dogs have tails. You know, what do we need to know about their tails?
Tails get shut indoors, and tails get pulled or stepped on. But most of the time, tails are pretty low maintenance. Something that, you know, you might want to be aware of is that's a really common place that fleas like to hang out. So it's a good place that we're going to be looking to kind of see if that might be an issue, if they're coming in for itching or scabs or something. In cats, that's one of the most common places they'll get into cat fights, because they're running away and the other cat will get a hold of them. So, you know, that's something that we might assess as well. Kind of the structure of it. If they get shut indoors, you know, they could have a fracture or something like that. The nice thing about tails is, worst case scenario, something happens, you can always take it off. They don't need it. So they use it to communicate, but cats, they use it more for balance, but they can still adapt. You know, they have those Manx cats that don't have tails, so they do okay. They get around all right. So.
And you see dogs sometimes with, you know, 3 legs or without tails or with tails. So, I mean, it seems like they're very adaptable.
They are it's amazing. I mean, we have dogs that come in blind, and you don't even know they're blind until we do the exam. So it's pretty amazing that animals can adjust to all of that pretty easily and subtly, so that we don't even notice.
How do you treat a broken tail, if that's something that happens?
Well, a lot of times we end up amputating it past the break, depending on where that's at. You know, and I think that'd be the easiest thing. You could probably try to splint it, but I think it'd be easier to just take it off. And again, they do really well. We'll have dogs, they get happy tail, like really, they're happy dogs. They wag their tail all the time, and if they hit it on hard surfaces repeatedly,
I didn't think about that.
They'll bust open the end, and so then you can wrap it, but then they just shake it off. And you know, so if we just dock it a little bit, and that's a medical reason. You know, there's some people that have issues with docking tails, because you know it's a cosmetic thing, but that's a medical reason to be doing that. And so they do pretty well for us. So.
And that's good, you know, to think about that. What about mouths? Mouths are a big one.
This is a really good thing to assess at home, and now that he's laying down, it's kind of hard to see, but it's really good to get them used to their mouths being opened, and you can kind of look at their gum color. I don't know if you guys can see it, but it's nice and pink, and that means he's getting oxygen. That means it's flowing and he's moving air, and you can look at their teeth as well. And he's got tartar on the back teeth, but the front ones look really good. And that's gonna be something you can do at home to assess them, because the gum color is really important. Like I said, if it's pink, that means that the red blood cells are flowing, they're moving oxygen. If it turns white, they could be anemic. I mean, it could mean some other things too, but that's a really good assessment of what could be going on. If it's blue, they're not moving oxygen. You know, those blood cells are getting there, but they're not carrying the oxygen like they should be. Or like a real murky brown color, they need to be seen if that's the case. But that's gonna help you, you know, like if you think your dog's not, you know, we go back to that reverse sneezing, like it can't breathe, look at its gums. If it's pink, they're breathing.
They're moving oxygen. Okay.
You do get occasional dogs that have those pigment, like their black gums.
Right.
So you can look at their tongue. You can look at anything that's pink. Sometimes their pads or their ears.
Around their eyes occasionally is pink.
So all that. I mean, we had a dog, unfortunately, the other day that came in, and we looked at its eyes and its gums and even its ears, and it was all yellow. So that's, you know, that means there's something serious going on. So that's one of the first things. If you think your dog's having trouble breathing, you can look at the mouth and really assess that. But then we also assess the teeth for other health issues. But those mucous membranes can really tell us a lot.
And that's good to note. And again, you would get a baseline so that you would know if that's different, because some dogs do have the splotchy colored gums or tongues or whatever. So those are good things to keep in mind as we're looking at our animals. Is it the same for cats? Can you look in a cat's mouth?
Yeah, you can.
I don't know that I would. I was say I don't know that I would want to try, but
yeah, that's probably, I think, a lot of times when they come into the clinic, one of their least favorite parts of the exam is opening that mouth. So we try to be quick. The nice thing with cats too is if you can kind of, whenever we're looking at them, you may notice that your doctor pushes underneath here.
Yes.
And they look underneath the tongue, because cats, they like to play with string.
Right.
We don't really recommend that, because it can get wrapped around their tongue, and then it goes down their GI tract, and it just pulls all those intestines back up because it's anchored underneath their tongue.
Oh my.
Then it kind of saws through
That
there.
can be pretty serious.
Yeah, so that's why we're looking to make sure they haven't stored anything up underneath their tongue. It's less common in dogs because they don't tend to play with strings as much, but it can happen.
Sure, I mean, you could tear apart a stuffed animal or something like that
Or
would
collar
be stringy at the end, or a collar.
So
That's good to note. What about other things? What are common, you know, when should you call the vet? When should you really be concerned? I mean, you said reverse sneezing is just kind of what it is. Check their
if
teeth.
you have a question, you know, with that, it's pretty easily fixed with the reverse sneezing. But if there's just anything that you notice that they're, you know, Charlie's a really active guy. I know this doesn't show it, but, you know, if he went through a phase, you know, that he was just down. He doesn't miss meals. He wasn't interested in his food. I took him in, you know, I'm like, this is not him. He's usually very active. He doesn't skip meals. Something's just not right. And he just had a little bug of some sort, just like we get. His blood work was all fine, you know, x-rays, everything was good, but you know, you don't know until you take them in. And that's something else you can assess at home that I forgot. It's gross, but you can take their temperature. The most effective way is to use a thermometer in the rear end area. But it's good to know that their temperature their normal is 100 to like 10, we'll accept up to like 1025, because sometimes if they're nervous or excited, but 100 to 1015, 1025 is normal. If it's over that, they've got a temperature. And so we need to kind of know what that's from, whether it's from them being sick, from inflammation, or anything like that. And that's when you want to let your doctor know.
Sure, and that's a little higher than people, so that's good to know that they will be a little higher. So, you know, if they're at 99, you probably don't need to call.
Right,
you know,
and people always think, oh, they're hot, so I know they have a fever, but they're gonna feel hot. You may just not have noticed that until you're really petting them like they don't feel well. But they will always feel warm to you because they are a couple degrees or several degrees warmer than you are.
What are other things you can notice about animals not feeling well? You know, of course they're not up to their normal activity level. Is it eating? Is it?
Yeah, eating, of course, like vomiting, you know, diarrhea. You know, hiding in cats is a big thing. They don't, you know, maybe you have that's a social cat, or even if it's not social, it's at least in the room with you. If it's hiding under the bed, or it's just hanging out in weird spots, that might be something to look into. That might cue you in that there could be something so then you need to check, oh, maybe that food bowl hasn't been empty, which is why I always like the meal feeding. They get a certain amount of time to eat so you can kind of assess it. But let's say you've got a dog or a cat that has food down all the time, and maybe you've got multiple people in the family filling it, but nobody knew that it hasn't been filled for a couple days, but everyone thought that it had been.
Right.
So, you know, if you notice that they're laying somewhere strange or doing something odd, that might be a sign. We had one client in that they're like, you know, my dog just started licking the walls.
Yeah, that's a little odd.
Yeah, and it just hadn't done that before, and, you know, it turns out it had some anxiety issues that we're working through. So, you know, those are things you just kind of want to pay attention to, and the more you know, I'm not saying you have to sit there and study your dog and take notes all the time, but just kind of be aware of what is normal. Like, if I leave a room and he doesn't follow me, that is abnormal for him. So then that kind of alerts me either, oh, yeah, he did have a big day. He was really active, so he's probably just tired, or maybe there's something else going on.
Right, so paying attention to all of those things all the time is good to notice. What about, we're talking about general health and wellness and assessing your pets at home. What about like water? How often should you be changing pet water and general health things like that?
Yeah, that's actually a really good question, because it does depend on the dog and cat and the time of year. Because you've noticed, I've noticed a few people that have said, oh, my dog's drinking an awful lot. Well, it's been really dry. I've been drinking more. Your furnace is running, it's really dry out, they're gonna drink more. And then the top of the summer, they're gonna drink a lot more as well.
Right, they're hot, it's more active.
So, those are gonna be things. But the general rule of thumb, and not every dog follows this, is kind of they need an ounce per pound of water a day.
Okay.
And the beagle that I had growing up, she would drink water if you put in front of her, nonstop. She got to the point where her urine was the same concentration as water. So I had to end up having to limit her. Now, not every dog needs to be limited, and you can just keep filling it, but you're like, I filled that this morning, and usually I only fill it once a day.
Right.
And you're filling it more. That's a really good sign to go to the doctor. It could be something as simple as a bladder infection, or it's dry out, but it could be something more serious like diabetes or kidney disease or something like that. So you may want to, have that with your conversation with your vet.
Right, and I know you can't go in the yard and, collect their urine every time they go to the bathroom, but should you be noticing how many times a day they're going?
Yeah, I think that's, like I said, the more information you can give us, the better we're going to be able to hone in on the tests we need. Otherwise, we're just going to start, recommending tests to try to rule things out. So if you come in and you say, my dog's drinking a lot and that's it, we're going to want to do blood work. We're going to want to check a urine sample. If you're like, it's going outside and it's going out more frequently, it's having accidents, and it's squatting and then getting up and squatting and getting up, we might start with a urine sample first, because that might be an indication of a bladder infection rather than, needing the blood work. And they may recommend all of it, but we can kind of start to fine tune it a little bit based on what you're describing to us.
How often should you be cleaning the things they drink and eat out of, and how should you be cleaning those?
Yeah, I think I'm definitely guilty of this, not doing it often enough, but it depends on your dog. If you are feeding a raw diet, it needs to be cleaned every meal, absolutely every meal. If it's just a normal diet and he doesn't have any like dietary restrictions or anything like that, once a week is really good if you can do it. If you can do it every day, that's awesome, because we change our plates and stuff every day.
Right.
But it depends on the type of bowl you have too. Plastic bowls probably need to be washed a little more often, because that stuff's going to get seated down in there.
More porous.
Think of their saliva. It's probably got bacteria and it's going to get stuck in there. The food, like let's say your dog ends up having a food reaction and needs to change foods, you're going to want to really clean that. I usually use Dawn dish soap to really get in there and kind of get everything cleaned up. But that's why I like the ceramic or the stainless steel bowls. We have plenty of animals that are allergic to plastic, and they'll break out underneath their chin from having that in there.
So you just want to make sure you're cleaning just with a nice simple dish soap, and so you don't need to go
you can
overboard.
Put them in the dishwasher
As I say,
if you
is
want
the,
to.
is the dishwasher
you
okay?
sure can. It depends on your comfort level with if you want your dishes in there with them. I like to wash it by hand, and I know it's getting clean, and I remember to do it. And
so once a week would be adequate.
Yeah, most of the time, yeah.
And stainless steel and ceramic are the better choices. Plastic's okay though?
Plastic's okay. It's just if I notice an animal, a cat or dog that comes in and they have a reaction, I usually recommend switching to the plastic or ceramic because it just seems to be less harboring of bacteria, easier to clean.
No more pores in that necessarily, and less able to crack things like that.
Yeah.
So, okay. So, we have a couple minutes left here, and as we're getting ready to go, what are a couple more tips for assessing your pet's health at home or keeping your pets healthy at home?
Well, I think keeping them healthy is, obviously have a conversation with your veterinarian, but, feeding a good quality food, that's going to really, you're going to notice that their coat's healthier. And that's another thing you can look at too. If you notice a cat, because sometimes, like we said earlier, they hide things. What if their hair is getting real matted now? Or it's looking really flaky? That could be a sign that they're not taking care of themselves, or they're not getting the nutrients that they need, which you may need to reevaluate your pet food, or may need to take them into the vet to evaluate their health. And there may be something else going on. They come in with big mats or something, we may want to run a little blood work and make sure there's not something inside causing this outward appearance.
And so, I guess when in doubt, you can call your veterinarian.
Yeah,
that's usually...
we'd rather be preemptive, so that, because, we never like delivering, bad news, and if we can catch something early, I think that makes all the difference in the world.
But hopefully, after hearing some of this, they've had some tips. They can look at the animals at home. But it sounds like getting a baseline really is the best way to start.
It will help you so much, because if you come in and you're like, well, my dog's not eating very much, and we ask, well, how much do they eat in a day? I don't know, I just fill the bowl up. I mean, that's great that they have food and water available, but we need to, I mean, if they normally eat 2 cups and they're only eating 1 3/4, maybe that's not as big of a change as they're not eating, they're eating 1/4 of a cup.
Right.
So those are really important things to kind of identify.
So the more information, the better. Take that all to your veterinarian as often as possible.
Yeah.
So, all right, well, Dr. Marci Kirk from Alban Animal Hospitals and Charlie down here on the floor, thank you for coming in and helping us assess the wellness of our pets at home. We appreciate you coming.
Thanks for having me.
Did you know full episodes of the Paw Report are on YouTube? They can be accessed at www.youtube.com/WEIUTV. Then just go to the Paw Report playlist and select the episode you want to see. More information about the show is also available 24/7 on our website at weiu.net under the Television tab.
If you are a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Production for the Paw Report is made possible by
Inyart Tire and Auto Center in Charleston and Mattoon. Inyart offers complete auto repair. Inyart Tire and Auto Center cares about our community and thanks you for being a responsible pet owner. More information at inyart.com.